everyone, good afternoon. I'm Dr. June here. So thank you for joining our live this evening. Our topic for today is from start to slim, regarding the hormones and injection breakthrough in the journey of slimming. Okay, so we will be talking about something that we always see in our clinic. Okay, for a lot of patients who are trying to lose weight by reducing their eating portion or reducing taking carbohydrate like rice or sugar, and also going for walks or doing exercise, gym, or trying intermittent fasting. But some of them are still stuck in losing weight, okay, or they lose a little bit of weight but then easily bounce back again. Yes.
Yes, that's correct. So, good evening. I'm Dr. Melissa. So, if you are one that has tried everything but you don't see any changes in your body weight, or you are one that you think that your body is very stubborn or some kind of engine is just not working in your body, this live session is perfect for you. Okay, so here today our goal is to help you to understand why losing weight is not just about willpower, such as extreme dieting, extreme exercises, no. Okay, and how your hormones and also metabolism actually help with your weight loss. And lastly, from our professional view of um, opinion, how we combined supplements, medications, aesthetic injections, and also aesthetic machines to help you to lose weight, most importantly, safely and effectively. Yes. So you may drop your questions anytime during this live session in the comment box below. Okay, and we will answer you at the end of this session. So don't forget, at the end of this session, we have some special live promotion for you as well. So do stay tuned till the end of this session.
Okay, yes. So now let's dive into our topic today. So maybe some of you who are seeing this live session can drop in your comment box whether is this you that you experience while in the journey of trying to lose weight. Okay, so yeah, maybe some of you will think that I eat lesser than my friends or my family, and I join a lot of classes, go for gym, Zumba, okay, or yes, but your weight is just not losing, or maybe you have lose some weight but then it's stuck, it's like a stagnant period, okay, when you relax, then your weight gain back again easily, or maybe some of you just feel like after some time you are become less motivated or feel like your energy is drained. Yeah. So if any one of you is experiencing this now, yeah, if you are in a journey of losing weight, okay. So why is this so? Why some of us will have this kind of experience or feeling? Okay. Okay. This is because weight loss is it seems like simple, but actually not. It's not just like you eat less and you move more, okay, then your weight will just drop like that, okay. Yeah, this is because, okay, if someone is trying very strict diet or extreme exercise, okay, actually our body is very intelligent, okay, it will try to protect you because they will sense that as a danger, so that they will activate their protection system, okay, to try to protect you. So if someone is on strict dieting or in chronic stress, okay, so they will sense that as danger, and they will try to slow you down by slowing down your metabolism to reduce their energy, to save your energy, and also they will think that, oh, maybe you are in like something of like starvation, okay, so they will increase your hunger signal, your craving signal. So sometimes the more you on your strict diet, then maybe the more you will feel the hungerness and more craving, okay. and all this also will tends to hold the fat into around your tummy, okay, and also eventually, and this will also make you feel like less energy, less tired, and then also less motivated to try out everything without you realizing.
Okay, so that's correct, Dr. Jun. So what she mentioned is actually when your body go into this protection mode. So think of it as the calories in your body is like the money, and then your hormones is actually the CEO of the company. So hormones is actually the one giving instructions to whether to save your calories or not. Okay, so when your body turn into this protection or starvation mode, the hormones will actually instruct your body to store more fat, more calories, and then cut down on your energy usage and make you more hungry again so that you will eat more. So this is actually what Dr. Jun mentioned, the starvation or the protection mode, to make your body preserve or conserve more energy, like preparing for a war. Okay, so that's why even if you do a lot of exercises or gym, when the hormones still ask you to save more calories, save more fat, you will still gain weight in the process, and it will be very difficult to lose weight. So the key here is actually the hormones.
Yes, exactly. So there are a few hormones that plays a very important part in our weight gain and also weight loss. Okay, so the first one will be the insulin. Okay, so insulin actually is a hormone that will be releasing from our pancreas when we eat food, especially carbohydrate food, sugar food. Okay, its job is to help our cell to move the sugar from the bloodstream to our cell so that our cell can use it to create energy. Okay, so if someone frequently eat like high refined sugar things, carbohydrate, okay, like white bread, noodle, okay, white rice, or something sweet, drinks, sweet food, okay, desserts, snacking, okay, and also this will our body will respond by releasing insulin. But if we constantly eat this kind of food, so our pancreas will keep on releasing this insulin. At one time, our cell will become like less sensitive to the insulin that we release, and this will become a situation we call as insulin resistance. Okay, so when our body have this insulin resistance, our body will respond by releasing more and more insulin, okay, to ask our cell to get all this insulin into our cell body cells. Okay, so when the insulin is too high in our body, it will ask your body to store more fat, especially around our tummy, okay, and they will keep this fat as a energy. Yes, okay, and other than keep on eating all those high refined sugar thingy, some other factor that will affect our insulin sensitivity is like poor sleep or like high stress, okay, or inactivity, things like that. Yes, and some clues that we can see if whether someone has insulin resistance is like just now I said is they may be fat around their tummy but slim over the legs and the limbs. Okay, and also someone will feel sleepy after their big meals. Okay, and constantly and having strong craving for the carbohydrate food. Yes. Okay. So insulin resistance is a very important part that we need to address while we're trying to lose our weight.
So that means obese people will have some kind of insulin resistance. Okay, understand. So insulin is the main hormones that's controlling
Yes.
our body weight or visceral fat. So the next hormones that we are going to discuss are the ghrelin and leptin. Okay, as what we can see from this slide, ghrelin is actually the hunger hormones and leptin is the fullness hormone. So ghrelin actually it tells us that we are hungry, we have to eat. And leptin is the hormone that breaks, that means tell us that we are full, we should stop eating now. So when our body is in the mode, or we say the protection mode, because of stress, chronic stress, because of crash diet, okay, and because of lack of sleep, all this can actually make our ghrelin and leptin imbalance. So what happens is actually the ghrelin or the hunger hormone will be activated or will be like higher. So you'll feel hungry more often. At the same time, your leptin in your brain will become resistant. That means you don't feel full. So you'll constantly be craving for something like dessert or carbohydrates, like what Dr. Jun said. Okay, so you may eat a normal portions of food, but you still feel like you want to eat some more, or you keep thinking about snackings in between. Okay, so this is not about being greedy or weak, but it's actually how your body reacts when it's in the protection mode due to poor sleep, due to chronic stress, due to crash diet. So it's actually related to our hormones.
Yes. So next hormone will be the cortisol, which also known as stress hormone. Okay, so it was released when we are facing any stress situation. Okay, so in this modern era, we are facing a lot of stress. Okay, whether it's from our work, okay, office, or family relationship, or maybe about money, okay, financial stress, and also like we always on our phone, yeah, especially like before sleep, okay, and this all will cause a raise of cortisol level in our body, okay, and other than that is like if we are on long period of fasting or constantly taking like low carbohydrate food or like um, low calorie intakes, okay, this thing also can affect the cortisol level in our body, okay, so this if our cortisol level is constantly elevated in our body, okay, this can increase craving, okay, craving especially in sweet food, for sweet food and like salty food, yeah, and also it can promote insulin resistance, okay, and this can promote tummy fat storage as well, okay, and also break down our muscle, yeah, yes, and also it can also affect our sleep as well, and this can be a like vicious bad cycle, yeah, which promote fat storage and also to disrupt our effort to try to lose weight. Yes.
Yes, so this is very true, especially if for me, actually, last time when I was in secondary school or college, when I feel stressed about studies, actually, I do have a lot of cravings on junk food as well. So this is actually part of the hormones imbalance that's playing a role behind that. So stress can actually release cortisol that makes us have more cravings for all these kinds of junk food. Yes. Okay. So the next hormones that we are moving on is about thyroid hormone. Okay, so just now we talked about some people might feel that I've tried diet, exercise, but I still feel that my engine inside my body seems to be not functioning at the optimum rate. Okay, so the engine that we are talking about here is actually the thyroid hormone, because thyroid hormone is our control for our metabolism. Okay, so when our thyroid hormones are at the lower side, actually you will feel that everything will become slower. Okay, so you'll feel tired more easily, you'll feel low mood or not so easily depressed. We say easily depressed. Okay, you might get constipation and your hands feet will feel cold, okay? You will lose more hair, and of course, your weight will go up even though you try to reduce your intake already. So it's actually because of your slower metabolism, and the culprit behind is actually your suboptimal thyroid hormones. Okay, so sometimes we see patients who really eat very little, but their weight is so stubborn, and they have all the symptoms like tired, okay, and then constipation, cold intolerance, hair loss. So all these are actually signs of suboptimal thyroid. Okay, so that's when we start to suspect that the engine is not running at the normal speed, and not just that the driver is lazy, it's because the hormone is suboptimal. So from a blood test, we can actually confirm these symptoms and the hormones that is actually suboptimal.
Yes. So the next one will be our sex hormone. Sex hormones also play a very important part in losing weight. Okay, so when we have estrogen and progesterone imbalance, especially when we are aging, like up to 40s or perimenopause, okay, that's when our estrogen and progesterone started to lose and also become imbalanced. Okay, and also when our testosterone decline, this all can affect our weight as well. Okay, with this, how they affect the weight loss is with the imbalance of sex hormone. Okay, it can cause new or worsening of the tummy and also hip fat. Okay, and also fluid retention and also bloatedness. Okay, and it also can affect our sleep quality as well. Someone may feel like they're having night sweat. Okay, heat intolerance at night. Okay, and also they can affect our mood as well. Someone may become like very anxious, and also maybe have some emotional eating, binge eating, things like that. And also with declined testosterone and estrogen level, it can lower our muscle mass and also our muscle strength as well, which is very important in building our muscle and also trying to lose weight. Yes. So someone maybe there's someone like lean all the while, but then after 40 or after menopause, during menopause period, then suddenly they keep on losing weight, even though their lifestyle or their eating habit is not changing. Yeah. So this is the reason behind it.
Yes, so to summarize, actually, our weight is influenced by various hormones, as explained earlier. To start with, is actually our insulin hormone, followed by our leptin and ghrelin, our stress hormone, cortisol, our metabolism engine, our thyroid hormones, and also our sex hormones, estrogen, progesterone, testosterone, and not forgetting our gut inflammation, our body inflammation, our sleep quality, and lastly, our exercise, our movement. Okay, so this is why in our clinic we are actually different from others. We don't ask our patients to eat less and move more. Instead, we have to understand the physiology behind weight gain, and that is the hormones and the metabolism story. Yes.
Yes. Okay. So, the weight that we are having now is actually the outcome of our hormone signal and also the lifestyle that we having all this while. Okay, so the next things that we will be talking is about the injection breakthrough in helping weight loss. Okay, so the injection that we are talking about is a medical injection, okay, with evidence base behind, okay, and with a clear protocol and also monitoring, okay. So one of the injection, metabolic injection that can be helpful, okay, in guiding in helping weight loss is the metabolic and appetite regulating injection, okay, especially like GLP-1 and GIP hormone injection. this can help to reduce our hunger and craving, and someone will feel full faster, reduce appetite so that they don't eat too much. Okay, and also they can help to support better sugar control. Okay, so this injection is not to use alone. Okay, so and also it has some, how to say, the indication in it is especially suitable for those who is overweight and obese, and especially those with high visceral fat. Okay, and someone who already changed their diet and lifestyle but still can't break through the weight scale. Yes, so this is useful with this particular group of patient. Okay, so and there is some limitation in it. Is it work best? Okay, it work best if someone can try to change their diet. Okay, like reducing high refined sugar and getting enough protein and enough fibers. Okay, and also they may have some mild side effect. Okay, some may have like feeling abdominal discomfort, and some may feel nauseated. But this side effect is actually really minimized. Okay, with the GIP-1 hormone. Okay, yes. So and also if someone who has been using it long, once they stop it, it may regain, the weight may rebound back again if let's say the old lifestyle still not changes yet. Yes.
Okay, so in our clinic here, we don't just give injections when someone said, I want to slim down. Just like what Dr. Jun mentioned, it's not the sole treatment for weight loss. Instead, I would say that it is like additional treatment that can support weight loss. Okay, so before we suggest slimming injections to patient, we actually will assess patient's body weight, then the weight circumference, and also most importantly the visceral fat and the BMI. Okay, and from the medical history part, we will actually inquire more onto any history of diabetes, hypertension, family history of cancer. Also, is there any previous history of pancreatitis, thyroid cancer? Okay, and also is the patient on any other medications that might contraindicate with this injection? And of course, a full blood test will be done prior to prescribing the bioidentical hormones as well as the injection. Okay, so here in Revix Clinic, we always position injections as a tool with a proper plan, but it's not a magic wand for weight loss. Okay, so it's a supportive or additional tool on top of the hormones balancing supplements. Yes.
Yes. Okay, so how do we approach for someone who trying to lose their weight? Okay, so we can see it as a pyramid. Okay, from bottom to top. Okay, the foundation will be the lifestyle and behavior, such as like the food intake, the food timing, the quality of the food that you take, and also movement. Okay, such as doing exercise. Okay, and also manage your sleep and stress. Okay, and also like taking care of your gut health by taking the right food. Okay, so the second one will be the level 2 will be the bioidentical hormone and supplement to support your hormone, to balance out your hormone, and also to try to overcome the inflammation in our body. Okay, the third one will be oral medication and metabolic injection that we talked about earlier on, and the last one will be the machine and aesthetic treatment. So everyone approach will be different. Some may only need like lifestyle and behavior, and also with the bioidentical hormone and supplements. Okay, some may need more in more resistant case until like needing oral medication and metabolic injection. And for some stubborn fat, okay, pocket, then it may need machine and aesthetic treatment.
Yes, so I think you guys are very familiar with the lifestyle and the behavioral changes. So let me spend more time onto this bioidentical hormones, okay? Because many people are actually not fully understand about this and they are curious. Okay, so what is actually BHRT or bioidentical hormone replacement therapy? So BHRT are actually hormones that have the same chemical structures as the hormones that our body naturally produce. Okay, we will consider bioidentical hormones in patients who have clear symptoms of hormones imbalance. So number one, of course, they have sleep disturbance or they are in prolonged chronic stress. Okay, they have night sweats, hot flushes, okay, constipation, mood changes, brain fogging, easily tired, low libido, low motivation, and low mood. And of course, supported by a full blood test, including the hormonal test and the body inflammation test, to support the diagnosis. So, how can BHRT directly support the weight and body composition? By actually replacing our hormones, it can help to improve our sleep. Okay, because when we have better sleep, our hunger and stress hormones will start resetting. And number two, it will help to increase our body metabolism and energy as well, so that you will feel more energetic and your cells are constantly at the optimal level of metabolism to work. Okay, and of course, by supporting our muscle maintenance with some testosterone cream, actually it will make you building muscle more easily. Okay, and lastly, the PHRT also stabilize fluid retention and fat distribution in certain women. So our primary goal of prescribing BHRT is actually not about weight loss. That's actually an additional benefits that you get. But it's actually more onto resetting or restore the hormone imbalance that one is having. And most importantly, it helps to improve the quality of life, such as improving the energy level, improving the sleep, make you more emotionally stable, and subsequently you will have benefits of weight loss in the process as well. So weight and body composition will actually improve over time after starting these bioidentical hormones. How about supplements, Dr. Ju?
Yes. Okay. So maybe some of you will ask like whether if supplement they taking if they don't want anything else, if they only take supplement, can it help with weight loss? Okay. The answer will be supplement is a supporting tools. It's not the main tools in losing weight. Okay. So how supplements can help in losing weight is okay. We need to first like find out what is the cause, okay, behind it, okay, that block the progress of the weight loss, okay. So like if someone who is having some insulin resistant, okay, then we can supplement something that can support the blood sugar control and to improve our insulin sensitivity, okay. It's like as for example, okay, the supplement will be like chromium, okay, chromium, magnesium, and also vitamin D. Yeah, okay. This can help ourselves to respond to the insulin better and to reduce the sugars crash spike. Okay, and also and can reduce our craving for sugar and salty food. Yes, and if someone is constantly in like high stress level or having some trouble in sleeping, okay, if they want to take like hormone, okay, then what supplement can help is like magnesium in glycemic form. It can help to calm down our nervous system, and also by then it can improve our sleep quality. So with better sleep quality, it can help to stabilize our stress hormone and also the hunger hormone. Yes, okay. So to reduce inflammation and to support our metabolic system and also like our hormones such as like thyroid hormone. Okay, the supplement that we can take is like selenium. Okay, and chromium. Okay, again chromium. Okay, and magnesium and okay, and also like curcumin and coenzyme is also a very good and potent anti-inflammatory and antioxidant. Okay, so this can also support our liver health, our cardiovascular, and also our metabolic health as well. Okay, so for our gut health, we can consume some like probiotic. Okay, this can help to balance out our microbiomes in our gut lining and also to strengthen our gut barrier. Yes.
Okay, so in addition to bioidentical hormones and supplements, there are actually oral medications as well that can help in weight and metabolic management. Okay, so some medications help to reduce the insulin resistance, and also some help with controlling the appetite or change how the nutrients are handled in our bodies. So oral medications actually we consider when your lifestyle has been tried seriously but is still not enough, or when in patients where there is very clear metabolic risks such as those with pre-diabetic state or those with diabetes, fatty liver, and those with very high visceral fat. And we will have to monitor and follow up with patients along the way when patient is on this oral medication as well. So we treat medication as a bridging tools. So they lower the biological wall so that the bioidentical hormones and supplements can kick in more easily to give results. And meanwhile, we work on habits and hormones, and over time, if possible, we will try to reduce or stop the medication while keeping the lifestyle changes. So, our medications are just temporary measures to help to it's like bridging tools for the bioidentical hormones and supplements to give results to patients. And we prescribe in those patients with metabolic risk. And they will need close monitoring and follow up. So examples of oral medications are like metformin, okay, and also Rybelsus, which are currently in the market right now. Yes.
Yes. So other than oral medication, which can help with our metabolic, okay, and also like insulin sensitivity. The other thing is the metabolic and also appetite regulatory injection that we mentioned earlier on. Okay, so when we start someone on this injection, okay, we need to also make sure whether they have their proper nutrition or not, such as getting enough protein, enough fibers, and getting less refined sugar. Okay, this is to ensure that when they stop the injection, they will not rebound that easily. Okay, and also other than that, we need to address the other stress issue as well, sleep issue as well. Okay, and also we need to check their hormones that we mentioned earlier on. Okay, and by giving the injection, okay, we will also follow up with patient regularly, okay, to check their weight and body composition, and also to check whether they experience any side effect or not, so that we can adjust the dose accurately. Okay, and more, yes. So injection is part of the weight loss program with a structure and supervised phase. Okay, yes, and also after when we monitoring their body weight, then if their body weight already achieve the target weight, ideal weight, okay, the residual fat is already at the ideal level, then at the time we can consider to taper down and stop the dosage.
So now let's talk about aesthetic tools, because many of you also ask about these fat freezing, lipolysis, or muscle toning machines and skin tightening devices. So just like what Dr. Jun mentioned before, these actually help to treat pockets of fats but not visceral fat. So this part is more onto subcutaneous fat. Okay, so after slimming down or after your visceral fat has gone down, actually in the process, if you are concerned about these pockets of fat, you can consider treatments such as fat freezing or lipolysis, which is in the first picture. And then number 2 picture is actually, we call it as the muscle building machine MSCAP. And also the third picture on the right top is actually mesolipo or lipolysis injection. And lastly is actually radiofrequency, or we say skin tightening machines that help to tighten up the loose skin. Okay, so in simple terms, these are specifically for localized area of fat or subcutaneous fat if you are still concerned. Yes. So, Dr. Jun, how do we decide when to use these machines or aesthetic tools? If somebody walk in with like BMI 30 and then visceral fat very high, so is he or she suitable to do such machines-based treatments?
Yes, okay. So, if someone is having like high BMI, overweight, obese, and high visceral fat, so it is obviously that someone is having some high rate inflammation in the body. Okay, so of course, this kind of patient can be benefit from machine and aesthetic treatment, but with limitation. Okay, so that's why we need to work on their hormones, their metabolism, and also their lifestyle. Okay, if possible, and by reducing the inflammation in their body, correcting their hormones. So when in combination with this machine and aesthetic treatment, then they can see much more better and significant result. Okay, or let's say someone which already skinny but there's some stubborn fat, maybe under the chin, okay, or maybe over the bra fat, yeah, then this kind of patient we can consider to just use like machine or aesthetic treatment for them.
So we always remind patients that machines and aesthetic tools are for shaping,
Yes,
and refinement. So not to replace your healthy eating habits and your body metabolism control. So this is actually for support and not the whole solution. Yes. So alright, I think we have come to almost the end of the session. So we will see, is there any other questions from the floor? And yes, so today's live only promotion will be on the slimming injection, the Monjaro injection. So it's actually a weekly injection which can last you for about 1 to 1.5 months or almost 2 months. So our normal price is 2,188, and right now how much is it?
now it's only 1788.
Oh,
Yeah,
okay.
and you can inject up till 6 to 8
Mm,
times
okay.
to inject weekly.
Okay, so there are only how many slots?
3 slots. Yeah, so
So-
it's very limited.
Yeah, it's very limited. Okay.
So if you are having trouble in controlling your craving and appetite, okay, and also struggling in losing weight, okay, then you can claim this special promo, okay, during this live by tapping M in the comment box.
Yes.
Yes. So now we will see whether is there any question from the floor.
So Monjaro injections are actually suitable for those who has increased appetite, or those who cannot control their appetite and and those who are like having difficulty to lose weight, even though they have tried gym, personal training, and then extreme dieting, intermittent fasting, but still you don't see results or you are still stuck at your weighing scale. Okay, so this Mounjaro injection is actually an additional tool to actually help you to lose weight. Yes, okay. So of course, not forgetting bioidentical hormones and supplementations. So to tackle your weight loss more effectively, a complete blood test is actually suggested before starting any treatment. Yes, so that we will be able to picturize the whole body situation, including the inflammation and the hormones level.
Yeah, exactly.
Okay, so we have this question from the floor. Doctor, can this treatment be done by teenager age? Okay, teenager.
Okay, teenager, for teenager age. Okay, so we will, of course, we will try to adjust, okay, their lifestyle and also diet first, okay. But if let's say this thing doesn't work, okay, then yeah, we need to dig in deeper, okay, to see whether is it is she or he is having some sleep issue or maybe stress from the school, from the homework, okay. Yeah, all this need to be addressed, and then yeah, by supporting this issue, then yes, we can give some supplement to support, and also like bioidentical hormone is also actually very safe, yeah, even in teenager age.
Or to be specific, actually this Mounjaro, if you're asking about Mounjaro, if Mounjaro is only for 18 years and above, yes, okay. So if for supplementations, bioidentical hormones, it's actually any age group depending on your symptoms, just like what Dr. Jun mentioned. Yes. So any other questions? So Mounjaro is also suitable for those with diabetes, right?
Yes, diabetes, but
Because it helps with insulin resistance as well.
yes.
How about those with diabetes type 1?
Okay, if someone with diabetes type 1, then it's not advisable to take it, because in diabetes type 1, it already have not enough insulin production, so this can increase the risk of like hypoglycemia, low sugar, which is really very dangerous in this kind of patients.
So about if patient is on Mounjaro injection and they have reduced appetite, will they get hypoglycemia attack easily, or should we have to advise them to eat normally?
Yeah, so in those patients who are taking Mounjaro, okay, so when you're eating, you eat normally, but of course, if can, the best is you choose the food that you eat. Yeah,
I mean more protein.
yeah, more protein, more fibers. Okay, eat whole food, not processed food. Yes. So we got Cheryl and Zati. Yeah. Who type M in our Instagram. Yes. So Cheryl is asking whether someone can do this Mounjaro without doctor advices. Yes. So yeah. So actually it's advised to have a doctor to monitor your progress, and because doctor can by monitoring your progress and symptoms, okay, and your weight reduction, um, yeah, then they can adjust the dose. They can decide what dose
You
will
should
be
inject.
suitable for you. Yes.
And also, it's a
also,
prescription
yeah,
only
it's a prescription only medication.
medications.
Yes.
So it requires close monitoring and
Monitoring.
follow up as
Yes.
well for our patient safety.
Mm.
Yes, and for better results,
Mm.
just like what Dr. Ju mentioned.
Okay, so don't forget again, yeah, we have this life only promotion for
Yes.
Monjaro injection, which is 5 mg.
Mm.
Okay, their normal price is 2,188, and for today only and until 6 p.m. only. Okay, only 3 slot. Okay, and it's now only 1788. Yes. So if you are struggling with your weight loss, struggling to control your diet, your craving, okay, then yes, you can type N in comment box to claim your life only promotion.
Yes, I think only left one slot because
Yes.
already claimed by Zati and Xuan Rong.
Yes.
So previously there was also some slimming injections known as Ozempic. So how is it different from Mounjaro?
Okay.
Is Mounjaro better?
Okay. Ozempic is the GLP one agonist
Okay.
hormones. Okay, so yeah, it helps to reduce your appetite, your craving. Okay, as well. Then in Monjaro there is another hormone other than GLP-1 is the GIP-1. Okay, this one is an additional benefit on top of the GLP-1 to enhance the how to say your stop your sugar craving and also your better sugar control, and also it can insulin resistant, and also it claim that it can like burn fat more. Yes.
So most importantly, I think Ozempic it has very serious side effects, just like vomiting, nausea. But Mounjaro is actually considered minimal
Yes.
to nil.
Yeah,
Yes.
because the other hormone that is called GIP essentially can help to
Counter the effect.
counter
Yes.
the vomiting effect. Yes. Okay, we have another viewer, Chen Y, already typed N. Yeah,
Yes.
so yes, I think all three
Slots are already taken out.
taken out. Yes, but if there is any more people who would like to claim it, also can type N. If there's more than 3 slots,
Then we will inform you.
Yeah.
Yes. So thank you for the support and thank you for attending our live session today.
Yes. So if there is one message that you can take it home from this live today is, if you already tried everything out and you feel that you already try doing everything right, but then you still stuck with trying to lose weight, then it's not your fault. Don't worry. Just that you need to look at that again, and with get a doctor consultation to look into your hormones and metabolism. Okay, and we will help you with that. Yes.
Yes, come forward for a doctor consultation because we are also having free consultation until the end of this month. Okay, and also in addition, we have promotion for blood tests as well. So this is actually just the right time for you to lose it just before New Year and also Chinese New Year.
Yes. So yes, so if you or someone, yeah, which close to you would like to get more help in losing weight, then feel free to contact us
Yes.
by contacting our Facebook or our WhatsApp or to call in to book a time for consultation appointment.
Yes.
We'll be happy to help you with that. Okay.
Yes.
So thank you again
Okay,
for
thank
joining
you.
us this evening. So we shall see you again during our next live.
Yes,
Which
which
will
is
be
after
on
2 weeks.
Yeah, after
Yes.
2 weeks on
Okay.
the 31st of December. Yes.
Yes. So thank you and have a good evening with your family. Bye and see you.